This question states, a patient presents with a laceration on their arm. As a medical assistant, what is the first step that you should take? And I've known a laceration is like a surface level cut on the arm. Also, as a disclaimer, just note that your role as a medical assistant might vary in different settings. This might be the role more of a RN or a registered nurse or an LPN, a licensed practical nurse might be doing. But if this is something that you are doing in your practice, also of note that everything would require an order from a provider. So make sure that your provider is aware if there is some sort of cut on the patient before you start cleaning it, unless it's proper protocol within your practice that anytime there's a cut, the medical assistant could take care of it on their own. So just make sure you understand what your specific role is where you're working. But anyway, back to the question. So a patient presents with this laceration, assuming that you have full responsibility to care for it, what would your next step be? Option A, stitch the wound immediately. That would definitely be incorrect because you shouldn't be stitching something that's usually not in the scope of the medical assistant. And usually a laceration is just a small cut. Like maybe if you get a paper cut, that's like a laceration. And you usually don't need stitches for that. Option B says clean the wound with antiseptic solution. And yes, that might be something that you would consider doing at some point, but just note that the question states what is the first step that you do. So let's come back to option B. There might be a better choice. Option C says apply a bandage to the wound. And that also might be something that you would eventually be doing. Maybe you would clean the wound before applying the Band-Aid. But let's see if there's something else that you would do next, and we could put all these steps into order. So option D says assess the severity and the depth of the laceration. And yes, that sounds correct. In any sort of medical setting, the first thing you do is to assess. You just take a look. And you might think, oh, but if you start doing that, wouldn't that slow you down from treating the patient? And not necessarily, because assessment could just be giving it a glance, just to note in your head, okay, is this a lot of blood? Is this not? Is this a big cut? Is it a little cut? Just so you have an idea of what you're working with. And that's the first step that you do in any procedure. So this would be your first step. And since they're asking for the first step, we could go with option D. Option B would be your second step, because before you apply any bandage, you'd want to clean it off, apply antiseptic solution, and then lastly, you would bandage the wound. Option A we could remove immediately, because most likely you would not be stitching a wound like this. So the correct choice as your first step would be assess the severity and the depth of the laceration.